Good morning. Welcome to the 2023 Public Health Update Immunisation Day. It's very lovely to see you all. My name is Shauna Jacob, and I'm the Education Officer within the Immunisation Program at CDCD. Thank you for taking the time to join us in person and for those online via MS Teams. We have a very full agenda today, so I'm going to quickly share some house rules before we get started. Uh, Okay. Yep. Sorry, that was the wrong one. So for those attending today, please either switch off your mobiles or put them on silent mode. Just so you know, the restrooms are across the hallway from the theatrette doors. In the event of a fire, we will go out through the main building and congregate near the car park outside the building here. There are scheduled tea and lunch and afternoon breaks. This will be a great opportunity to catch up with each other and meet new colleagues. We will invite you to rejoin the sessions at the break, at the end of the break. So please work with us so we can keep on track. We have allocated question times at the end of each presentation, where we will take questions first from the room and then from our colleagues on Teams. Please note that not all the information that will be presented is for public use yet, so please don't take any pictures or record slides during the event. Please also note that there is the option to spread out. It will be quite full, I believe, by midday. There are hand sanitizers at the registration tea and coffee station and at the food tables. So feel free to practice good hand hygiene. There are also disposable face masks available at the registration table. And we'll keep the doors open for some ventilation. So for those joining via Teams, Cassie will have put some house rules on the chat. Please ensure that your microphone is muted at all times. The chat will be monitored throughout the day. So please place any questions for speakers into the chat and they will be asked on your behalf. Cassie will be monitoring that. So if you have any troubles with Teams, please send her an email, which has been placed in the chat and is also on the screen. Please note that questions will be taken at the end of each presentation. I will now invite Kelly Cameron, the Principal Project Officer for Aboriginal Immunisation at CDCD, to provide an acknowledgement of country, an opening address followed by Joanne Morgan, the Manager of the Immunisation Program at CDCD.
Thank you. Nala Kadich Nunga Mort, Kayan Kadich Nijabuja. I would like to acknowledge the Whadjuk people, my people of the Noongar Nation, as the traditional custodians of the lands that we're meeting on today. As a Whadjuk person, I ask you to join me in celebrating our culture today and every day and note how privileged we are to share our country. I'd like to pay my respects to my elders past, present and emerging, and would like to pay my respects to those from other lands present here today. Thank you.
My one slide. Thanks, Kelly, for doing our acknowledgement of country. And for those that don't know, Kelly is our lead for our Aboriginal immunisation team here at CDCD. So thanks very much, Kelly. So welcome everyone. This is really exciting for me to be up here. Normally I'm on the other side, so bear with me and my enthusiasm for the day. It'll probably continue until next year's as well. So on behalf of the wider CDCD immunisation team, I would like to welcome all of you to the 2023 Public Health Immunisation Update. And thank you for those who have travelled far and beyond. I think I've seen people from the Kimberley, the Goldfields and Metropolitan colleagues, so it's really good that people have come down. This year, we've expanded the invitation list to other key stakeholders to include representation from AHQA, TKI, WAFA, the Immunisation Foundation Australia, our university partnerships with UWA, ECU and Curtin. I think we have representatives from RACGP and the AMA, and also the Pharmaceutical Society of Australia and the Pharmacy Guild, plus our normal public health and community health staff. We're hoping by acknowledging that the immunisation landscape is changing in WA and across Australia, and therefore this invitee list has grown so that new relationships can be built and current relationships can be strengthened. By coming together to enhance our knowledge and understanding of immunisation practices, we can all learn something new every day, and by having a wide variety in our audience, I think that's going to help us with our steps forward. Today, we'll have the opportunity to listen and explore the challenges and achievements of our colleagues. Shauna has worked closely with the speakers to create a diverse agenda for today that we hope meets the needs of everyone, but please give us the feedback at the end so that we can develop more as we move along. So we're including cold chain auditing, we're exploring timeliness of vaccination, we're looking at access to immunisation services in the way of a health hub, we're looking at Aboriginal adolescent HPV vaccination in metropolitan Perth. We're looking at the Vaccinate WA transition to the SBIP program, which is a regional story that's being presented, vaccine safety surveillance, research projects, and so much more, as you'll see from the agenda. I would like to personally thank Shauna for her commitment to ensuring today's success. You've done an amazing job, Shauna, and I wish you all the best and look forward to next year's as well. Just jumping the gun here. But I wanted to point out, over the last year, there's been many activities led by the CDCD immunisation team, and I would like to highlight a few of these key achievements, also noting that many of you here today have played a key role. But before I move to that, I just want to acknowledge our Senior Medical Advisor, Dr. Paul Effley, is in Japan doing some work for the WHO. So although he would love to be here, I don't want to leave him out, but he's doing really important work over there and you'll see him next year. So our CDC immunisation team is structured with 8 sub-teams, for those that don't know, although the teams work across multiple program areas and support one another. They definitely have a collaborative approach to all of our activities, and I would just want to acknowledge the team for doing that, because without the 8 teams, we would never get anywhere without that collaboration. So I want to start with our Triple P. And for those community health nurses, that's not positive parenting, it's policy planning and projects, and this is led by Lindsay and Rebecca. Some of the key achievements there were the coordination and the implementation of the free flu vaccine program in 2023, which was a ministerial priority. This provided free of charge influenza vaccines for all people in WA in May and June this year, and over 365,000 vaccines were delivered during that period of time. That program will continue possibly for the next 3 years under a ministerial request. The evaluation of the WA Immunisation Strategy 2016 to 2023, I can't believe we've nearly come to the end of that strategy. This was aimed to assess the effectiveness of the implementation of that strategy and the appropriateness of it. Kaya will be presenting on that a little bit later. The development of the WA Immunisation Strategy 24-28, which is really exciting work, will provide a clear, actionable framework and enhancing immunisation service delivery and uptake across WA. Our new strategy will look completely different, and we've had some stakeholders engaged already, and there'll be further moving forward. But we had a day with that, I think it was about 4 or 5 weeks ago, and it was very positive, and we've gone out for feedback on the framework. Our next group, which is led by Pally, as everyone knows Pally, the Promotion Education Program, PEP. We call them by the acronyms. One of the big programs that Pally has led is the Vaccinate WA transition to include SBIP and the very recent review of that. We've had regional representation on this along with our metropolitan colleagues at CARS, and we're hoping that we have a workable solution within the next couple of weeks. In amongst all of that, with our core or lowered adolescent immunisation rates, we're doing a campaign scheduled in the school holidays to encourage those who have not yet received their Year 7 and 10 vaccines to try and reduce the workload for catch-ups next year. And we'll be encouraging people to attend community pharmacies, our GPs, AMSs and our community health clinics, so broadening where our school-based program can be accessed and using all of our service providers across WA. Our Aboriginal immunisation team, as I said, is led by Kelly Cameron, and with her new role coming in, the Aboriginal Immunisation, or the AIN Network Steering Committee, has been repurposed and is back on to support that and facilitate system-wide approach to improving Aboriginal and Torres Strait Islander immunisation rates. We've had 2 meetings thus far this year, and the next one will be at our AIN Forum in February 2024. Kelly's reviewed with the group the whole membership list and ensuring that we've got the best placed people around the table to deliver and drive key Aboriginal immunisations. This will lead into our Aboriginal Immunisation Network Forum, and that was held this year in February, and we had 57 engaged attendees. I must admit, I was there, and it was a very engaging day. I was there representing WACS at that time. And it was around sharing information and developing strategies to improve vaccination rates among Aboriginal people. That year, or this year, was a focus on young people. We don't know what we'll be doing next year, but we will communicate that moving forward with the planning. Our next team, vaccine safety, and I don't think Dale's here today, but Phoebe and Ishti should be somewhere sitting as well. The completion of the 21 and 2022 WA Vaccine Safety Surveillance annual reports. This was a huge undertaking taken by this team. They cleaned, reviewed and analysed over 14,000 adverse events following immunisation over those 2 years, and Ishti will be presenting on that team approach a little bit later today. Our DARE group, led by Rachel, which is our data analysis and reporting. You'll all have seen these, I'm assuming. Our dashboards are our reporting on Power BI around childhood immunisations, our school-based program and influenza. If you haven't, contact us and we can help you get access to those dashboards. Our vaccine data link, which is led by Lauren, and she'll be presenting a little bit later, always a topic of interest for me, so I'm glad she's presenting again today. But what that team has been doing is integrating our vaccine linkage work into BAU to routinely monitor safety, vaccine effectiveness and coverage in special interest groups. For those who've never listened to a vaccine data linkage talk, I suggest you listen to this. It is really interesting at the work that they're doing. And an interesting fact from our vaccine management team from Darren, just hands up quickly because I only have 7 minutes. Does anyone know how many vaccines we would distribute in a 12-month period across WA? You've got 10 seconds to come up with a number. Okay. What was that? No, but okay, so apparently it's 1.4 million doses, which is huge. And that's to over 1,300 vaccination providers in WA. That team coordinates all of that with our stakeholders, and it's a huge feat that they do every year. Our last team is our COVID vaccination program transition team, and John Coles has been leading that. Unfortunately, the Commonwealth, while we're supposed to be doing this transition, dropped a bit of a bombshell on us and has asked all states and territories to put that on hold. And we're waiting on a directive from the Commonwealth before we move further with that. But John's just tidying everything up so that we'll be ready to go when that occurs. But just to leave you, more importantly, today will provide an opportunity for networking and collaboration. I challenge everyone in this room today to introduce yourself to someone new, someone you've never met before. Share your ideas, share your expertise, because that's really important, and share your experiences. Let's grow our workforce and put our ideas into action, because we are definitely stronger together. Thank you.